Hi, everyone. Good evening. Thank you for joining us this evening to talk about the Psych Mental Health Nurse Practitioner program here at Frontier Nursing University. I'm so glad that you were able to make it this evening, take time out of your busy schedule, and I really do appreciate your attendance. Um, my name is Kevin Scalf. I'm the department chair for the Psych Mental Health Nurse Practitioner program here at FNU, and it is a pleasure to meet you virtually and interact with you and talk more about our program. So thank you so much for taking the time out to meet with us. I think I also have some colleagues here on the call that I'd like to have an opportunity for them to introduce themselves. Ava, I see you. Are you there?
Hey, my name's Ava Bumbu. I work on the marketing team. I'm the marketing and student recruitment manager.
Thank you, Ava. And do we have anyone from clinical advising or admissions?
Hey, my name's Sarah. I'm here from Clinical Advising. Welcome everyone. Thanks for joining us. We'll talk a little bit more about what my department does in just a bit, but let me know if you have any questions. I'll try to keep monitoring the chat.
Thank you, Sarah.
Thank you.
Okay. Anyone from admissions?
Ms. Jalicia Johnson, and I am here on behalf of admissions. Good
All
evening.
right. Hello. Nice to meet you.
Nice to meet you.
All right. So without further ado, we can get started. As we go through the presentation this evening, there will be people monitoring the chat that will help me to answer and field questions and that sort of thing. So feel free to you can unmute, talk about your question. You can type it in the chat. I just want us to have a really good informal conversation about our program. So again, thank you for coming out and being with us. I've already introduced myself. I'm Kevin Scalf. I'm the department chair here. Dr. Susan Piper was unable to be with us this evening, but she is the clinical director for our program as well. So you will learn more about her as you become more familiar with FNU. This first picture here is a photo that was taken on campus recently. And you see a few things that I want to point out here in this photo that really speaks to the values, the mission, and the philosophy of Frontier. This was taken on our new campus in Versailles, Kentucky, and it was during one of the bound sessions where students come and they learn about our university. You can see the students are all kind of in a circle with each other. They're kind of looking centrally at someone talking there, and this is really something that we value at Frontier. We call it Circle Up, which you can see the circle, but it's much more than just that. At the end of each day at Frontier, we all like to get together and reflect on the things that have occurred during that day. Um, each day you learn something different, you meet new people. There's just a whole new, wealth of experiences that you go through each day on campus. At the end of each day, we love to have students reflect and talk about their experiences. Part of this is community building because as a distance online education program, it's really important that you build relationships with each other, with faculty, with staff, because we want you to be part of our community. Once that you're part of our community, you always have a home at FNU. And so we love for students to come and build those relationships. What we find most oftentimes is when students come and they circle up and they talk about their thoughts, their feelings, their experiences on campus, I hear some themes that occur pretty regularly from multiple students. For example, some students say, well, I don't know if this was the right time for me, but I'm glad that I'm here because I see that I'm not the only one that was worried about that. Or some people would say, I really want to do this, but my life is extremely busy and I'm afraid that I won't be successful. That student came to campus and guess what? They heard the same thing from other students. And so it's really, I think it helps us when we hear that other people experience these worries and we're not alone. I think that's very helpful. And I think that really helps support students and sets them up for success. So we want you to be part of this community and we want you to be supported in the community. Really, that's what Frontier Nursing University is all about. Our university came about to meet the needs of the community. That's what we still want to do all around the country. We want to meet the needs of every community. And to be able to do that, we want to be a coach and a mentor to you as well. So having said that, you can see our mission down here at the bottom of the slide. And it's a very simple mission, but I think it's very thoughtful. And simply put, our mission is to provide a high quality education that prepares nurses to become competent, entrepreneurial, ethical, and compassionate nurse midwives and nurse practitioners to work with all people, emphasizing rural and underserved communities. Really, that is what we are all about here at Frontier Nursing University. So when you come on campus, when you enroll in your classes, when you become part of our community, um, you're supported. We're all here for your success, and we want to have some type of hand in your success so that we can help prepare you to meet the needs of your community. We've been doing distance education for quite some time, and there's some things that I love to bring about here as we talk about our program. The first bullet point that you see here is the culture of caring. This is kind of a framework that we use at the university to guide everything that we do every single day. The culture of caring is basically we value each other, we listen to each other, we respect each other, and we support each other. Everyone belongs here at Frontier, and we want everyone to feel that belonging. It's not enough to just say everyone has a home here at Frontier, but we want to work to make you feel welcome, to make you feel comfortable, to be able to develop an atmosphere that allows you to reach your full potential. That's what we want to do here at Frontier. And as you become more familiar with Frontier, I think you will see this culture of caring lived out and played from day to day and everybody that you come in contact with. This is what we're all about. It's not just about words, but it is what we use to guide ourselves each and every day is that culture of caring. You are not just a student number here at Frontier, but you're an individual. And we want to mentor you and coach you so that we can help prepare the next generation of providers. The other good thing about Frontier is you can use your community as a classroom. And so what do I mean by that? Well, once that you accept your offer of admission to Frontier, you come to campus for what we call Frontier Bound. Basically, what this is an orientation to the university. We talk about the history of the university. We talk about the programs of study. You get to meet the advising staff, the clinical advisors, financial aid, all of the people that you're going to need in your life to be successful. We introduce you to them. You meet your department chairs and your faculty, and it's just a big orientation. Once that you leave Frontier Bound, you go back home and you begin your didactic work. Now, at Frontier, the didactic work is front loaded. And what I mean by that is you take all of your didactic work first. So you get that out of the way. And once you finish your didactic work, you come back to campus for a second time for what we call clinical bound. Clinical bound is when you come back to campus and we help prepare you for clinical. And so what do I mean by that? When you go through your didactic coursework, you cover a lot of things, right? When you come to clinical bound, we help you put all of that together so that you can identify your strengths and opportunities, and you kind of can have something to gauge yourself as you go on into your clinical practicum with your preceptor. We have in the psych program, we have 3 sim labs that are set up like psych providers' offices. And we have standardized patients, which are professional actors. And you see patients back to back. You get a clinic schedule at the beginning of the day, and these are your patients that are coming in with real problems. So we create this environment where you use everything that you've learned in your didactic coursework into a patient care visit. And we do that all during the course of the week. So you really get a lot of good feedback. Once that you leave clinical bound, you're off, to do your clinical practicum in your community. And that's what we mean as you use your community as a classroom. You're invested in your community. People trust you in your community. And no doubt that's why you're here, is to help improve the health of your community. And so Frontier wants to add to that, and that's one of the beauties of our program. During those bounds that I talked about, when you come to campus at Frontier Bound and Clinical Bound, you will get to see our new campus. We moved into this campus in Versailles, Kentucky around 2020, 2021, somewhere through there. We're about 10, 12 minutes from the Bluegrass Airport in Lexington, but our campus is really beautiful, has lots of space, has really good things for you to do after the day is completed. We have walking trails, we have a fitness center, there's a reflection center. We value those things because we want you to build relationships with people. Not only is the academic work important, but we also need to give you opportunities in the evening to develop those relationships so that you can cultivate those and have them long after you graduate. That is so important. Those relationships are, especially as you're going through, your program. In distance education, it's awful easy to feel like you're the only one out there in cyberspace somewhere. We work really hard at Frontier to make that not happen. We love to interact with students. We want students to interact with each other. And so we want to optimize that, because when we interact and we feel like we're part of a group, the chances of us being successful are quadrupled. So we really do value that at FNU. A little bit about the history of the psych mental health nurse practitioner. I'm just going to briefly touch on this, but we have evolved over the years, right? In the mid-1960s, the nurse practitioner role came into being at the University of Colorado by a lady named Loretta Ford. Loretta Ford. And her and a physician worked on this role because there was a physician shortage at the time, and they really wanted to improve access to patients. Since that period of time, we've seen the role of the advanced practice nurse just kind of evolve. From a psychiatric standpoint, in the mid-70s, we had the clinical nurse specialist. Not really a nurse practitioner, but a clinical nurse specialist who had advanced training. That evolved over a period of time into the 1990s to be a psych mental health nurse practitioner with prescriptive authority who could assess, diagnose, treat, evaluate different mental health conditions in folks. The 2000s, we've kind of continued to evolve along the way. We continue to have increased autonomy, and we continue to work to meet the needs of the people across the country. One of the things that I have noticed over the years is we have psych mental health nurse practitioners employed in a variety of settings and locations. Not only do PMHMPs work in outpatient clinics and private practice, but they are in hospitals, emergency departments, the school system, the legal system. There's more and more places that utilize the services of a PMHMP. And we see that each and every day. Psych MPs practice in all 50 states and some foreign countries. So there's a huge presence of psych mental health nurse practitioners out there. We have also at the university, we've created a pretty big footprint in this profession as well. We have alumni practicing in all 50 states. And we really do take pride in that because, again, all of these people are going back and working in their communities. A little bit about our achievements in history. We've been doing this for a long time. We have over 100 years of experience in nurse midwifery and family care. Like I said just a few moments ago, we have students and alumni from every state. We've got more than 2,700 students right now, and we have over 10,000 graduates. Frontier Nursing University has been around for a long time. And it was actually, this is probably um, not well known, I don't think, but it is a fact. Frontier Nursing University had the first family nurse practitioner program in the country. So we've been around for a while, and we've been doing distance education for a long time. A little bit about our certification exam pass rates. Once that you complete the program, your degree is conferred. You sit for your national certification exam, and we get some statistics every year based on the pass rate of those exams. And so this past year, for the year 2024, our overall pass rate was a little over 96%. And nationally, the average out there is 83%. So across the nation, about 83% of students on average pass that exam on the first attempt. But at Frontier, as you can see, we're well above that at 96%. We've maintained high 90s in the certification exam pass rate for a long time now. And so our graduates have always performed very well on that. So you can really have, I think, confidence in your program, in your education, and the rigor and quality of the program at Frontier. And you can really feel confident that we will help prepare you to sit for that exam and launch on out into practice. Any questions at that point? I'm going to kind of stop and hit the pause button just to see if there's any questions about anything we've covered so far. Okay, not hearing anything. So I'll keep going. So let's talk about student support. We've talked about the fact that we want to help you be successful, right? So let's talk about that. When you get into your clinical practicum, you will have faculty that supervise your clinical hours. Those are regional clinical faculty members. They meet with you at least every couple of weeks, sometimes more often. They meet with your preceptors. The faculty meet with your preceptors before you start clinic. And then when you're about halfway through your clinical practicum, they will come out with you and spend, a day with you in clinic. And so we're very involved again in your education. Some students like to meet with their clinical faculty more often than 2 weeks, and that's okay. That's wonderful. But at a minimum, you meet with them face to face every 2 weeks through Zoom or something like that. And then they also communicate with your preceptor and do those visits as well. Our academic advisors and clinical advisors, our advisors are top notch. They know students on a personal basis, and they really do care about your success too. We also have student mentoring groups. We have financial aid and we give out scholarships. We have online library services and these student interest groups as well. Again, you can see that we really do value the interaction and the community building. We want you to be part of things and not just be a student that logs onto the computer, but we really want you to be part of our community. and network and enjoy your time here at Frontier. Just a little bit about scholarships also with student support. Scholarships are available in the spring and fall. There are some guidelines to scholarships that FNU does give out, however. You must have at least 24 earned credits with FNU, have a GPA of at least 3.25. The scholarships vary in amounts, but we do have over 20 of them. And in 2024, we awarded almost $1.7 million in scholarships to students to help them with their educational costs. So scholarships are something that we're continuing to build and add, and we're really glad that we have the opportunity to provide that for students. Sarah, do you want to talk about clinical outreach and placement and clinical advising?
Sure, absolutely. So, hi everyone. So, again, my name's Sarah. I'm one of the clinical advisors here at Frontier. So, our university has a long-standing tradition of empowering students to secure their own clinical sites, usually within their own communities. However, you'll have lots of resources at your disposal here to support you with that search. The first being our community map, which I believe currently has over 20,000 sites all throughout the country that we have partnerships with. And then since this is proprietary information, you won't have access to this until your first term. But keep in mind, you are not limited to just the sites and preceptors that we have on our community map. Anyone who's willing to work with you, for the most part, we're willing to work with. So we're always happy to add new partners. But this community map is a great place to start. So some of you will come into the program and maybe you already have a precept or a site in mind. That's perfectly fine. Others may not know where to start. That's okay too. That's what my department's here for. So we are here to support you, guide you, be a shoulder to lean on, everything in between. So my team will meet you all at Frontier Bound first, and then we'll be able to meet with you one-on-one as needed. Throughout your time here at Frontier, we also host group advising sessions each term that you can attend. But yeah, that's a little bit about my department. And if you have any questions, just let me know.
Thanks, Sarah. I will also add that we continue to build partnerships across the country. And what I mean by partnerships is we search out and we partner with facilities, with organizations. And what they do is they agree to take so many of our students each term. We help them with things like professional development needs, continuing education, that sort of thing. And so we're continually adding that partnership component to what we do here in the program. So that's another resource that we have to help with clinical site placement. Your regional clinical faculty members, they're usually geographically assigned, so they are familiar with where you are in the country, and sometimes they're a great resource too when you're doing your clinical search. So, like Sarah said, we're here to support you 100% of the way. You're not in this by yourself, and we will help you to navigate all of this stuff that you need. Just a few of our achievements that we've kind of put on here just to kind of show you, again, some of the things that we value. Higher Education and Excellence in Diversity Award, we were the recipient of in 2024. FNU has been recognized in 21, 22, 23, and 24 as one of the great colleges to work for. We received the AACN 2023 Award for Inclusive Excellence, Belonging, and Sustainability in Nursing Education. And also, we were named the academic honoree for the 2024 Healthy Work Environment Award presented by Sigma Theta Tau International. So we're really proud of those awards that we have. And again, I think this just kind of speaks to our mission, our values, and just our overall philosophy. We do have some degree options. I wanted to take a few minutes and talk about these. We offer the Master of Science in Nursing, the MSN, We do have a postgraduate certificate program for students who are already advanced practice nurses that want to come back and get their psych certification. And then we also have a Doctor of Nursing Practice program as well. In the advanced practice specialties, we offer programming for the family nurse practitioner, the nurse midwife, women's healthcare nurse practitioner, and the psychiatric mental health nurse practitioner. Those are our advanced practice specialty roles that we have here at the university. This is just a slide that kind of shows the progression of your journey throughout the entire Frontier experience. So if you see in the left-hand column where it says Frontier Bound Orientation, that's what I was talking about at the beginning of the presentation. When you come to campus and you meet each other, you meet the staff, you meet the faculty, you build relationships, and you learn about Frontier. So that's the first step. After you leave Frontier Bound, you go back into your home community and you begin the didactic coursework. All of this is online, and you get this out of the way first. When you finish your didactic work, you come back to campus for a few days to what we call clinical bound. This is where we help you to put everything together, give you some really good feedback, and just really help you become prepared to go to the clinical practicum. You reach your clinical practicum, and this is where you work with your preceptor and your regional clinical faculty and obtain your clinical hours, which is 750 hours. After you finish the clinical practicum, you take one final course, which is your comprehensive review course. That's basically a review of the entire program, and it helps you to, again, synthesize all of the information that you've learned in the program. After that, your MSN or your postgraduate certificate is conferred, and you're off to sit for your certification exam. So that's kind of the journey of the student from start to finish. All right. So does admissions want to talk about the admission criteria and the steps in the admissions process? I think we may have lost her. I can go ahead. I think she may be having some technical problems, technical issues. So our admissions criteria, you have to be a registered nurse with a current active license, at least a 3.0 GPA from your highest nursing degree. For the MSN admission, you can actually have a bachelor's degree in any field, and we require 1 year of RN experience. For the postgraduate certificate program, you have at least a master's degree or higher in nursing, and you are an APRN of some sort, whether that be a family nurse practitioner, nurse midwife. We've had CRNAs, we've had neonatal nurse practitioners, pediatric nurse practitioners. Any of those advanced practice specialty roles will do. So those are the two programs that we do offer. If you look here at the top of the screen, step one is you look at the admissions criteria. Step two is you get all of the things that you need to have submitted, and you complete those, and then you complete your application form. You apply online. There is a couple of essays that we want you to write. Your resume or CV, you gather your transcripts from your previous institutions of study. And then for students who have a bachelor's degree in, let's say, something else besides nursing, there's also a separate essay that you fill out that speaks to things like your leadership abilities, how you value collaboration and scholarship, how that your degree has actually helped you in in your nursing profession. And so that's an extra part for those students who have a bachelor's degree, but it's just not in nursing. So those are some of the required steps in the process. Any questions about that?
I had a question about clinicals in New York. I had seen somewhere online that um it's a little bit funny that in New York there's only like 6 students or something that are accepted. I'm a travel nurse, but I just wanted to know because my next contract will be in New York, so I just wanted to know what that means for me.
Yeah. So that's a great question. So in New York, and this is not just a frontier thing, but this is all over. The Board of Nursing in New York has very limited capacity to allow schools of nursing to come in. And so what that means is, um, right now, for anyway, you can live in New York and be a student at Frontier, but you won't be able to do clinicals in New York. That's what the Board of Nursing stipulates. So we do have some students in New York, but they do clinicals, for example, in New Jersey or a neighboring state somehow. We've had some students go through that process. The Board of Nursing in New York only allows just a few students in, a few schools in, and so it's highly restrictive. Does that help?
Yes, it does. Thank you.
Hopefully that will change, but as of right now, that's where we're at with New York. Okay. I'm looking at the chat here. Let's see.
Yeah, we have a question about preceptor types. Do you want me to tackle that one?
Yeah, sure.
Okay. So, I believe, and correct me if I'm wrong, Dr. Scalf, so your main preceptor would need to be another PMH&P, but in addition to a PMH&P, you can also rotate with PMH-CNSs with prescriptive authority. You can rotate with psychiatrists, and there's no limit on the amount of hours you can do with an MD or a DO. Also, you can rotate with licensed master's prepared therapy providers, so your LPCs, LMFTs, licensed clinical social workers, up to a max of 135 hours. And then just keep in mind, if you are in Alaska or Oregon, per the boards of nursing there, you are limited, unfortunately, to PMH&P and MD and DO preceptors. And then for Washington, it's limited to PMH&Ps, MDs, DOs, and LCSW preceptor types.
Thank you, Sarah.
No problem.
Um, I think going back up here, looks like Michael had a question. How many students are accepted each year? So at Frontier, we admit students each term. We have 4 terms per year. So we have a winter, spring, summer, and fall cohort. And each term we admit 100 students. So that's what we admit each term. So 400 a year is really what we end up meeting. Is it mandatory to attend the first orientation? I'm out of the country with my spouse on military duties. So that's a great question. It is highly encouraged, but we do make exceptions for situations such as this. And what we do usually is one of the faculty members or myself or Dr. Piper, our clinical director, will meet with you on Zoom and we cover some of the same stuff so that you still get a good orientation to the university. So we do make exceptions for cases like that. Um, Looks like Crystal's question we just addressed. Virginia, I just wanted to clarify how many entrance essays we do. So more than one. There are two, Virginia, short essays is all that is really the requirement. Any other states that are difficult to complete clinicals in, like New York? There's not to my knowledge, just the states that Sarah just mentioned who have restrictions on the types of preceptors that you can be with as dictated by the Board of Nursing. New York is the only state that we have problems like that with. No restrictions in California or Nevada. And so, yes, 450 hours of telehealth you can complete as part of the 750. Looks like Sarah already answered that. Okay. Can we transfer coursework in if we've taken master's levels courses elsewhere? So that's a great question. And yes, you can apply for course transfer credit. Usually what I see students do is they transfer like in the three Ps, advanced pharmacology, pathophysiology, and physical assessment. I see them transfer in a lot. We have to be careful. So there's a process for getting transfer credit. Once that you get in, you do this application through the registrar's office and it comes to me. I look at your transcripts and your course syllabi. What I'm really looking for is evidence that your courses were graduate level, 3 credit hours, and that they included across the lifespan content. That's really important with the certifying bodies because in order to sit for that certification exam with the ANCC, they have to have evidence that your courses contained content across the lifespan. Because if there's no evidence in those prior syllabi of that, then you run the chance of being denied, the ability to sit for your exam. We don't want that to happen. So that's one of the biggest things that I look at when you are applying for course transfer credit is that we can see evidence of that across the lifespan. But that was just a long way of answering your question, I guess. Yes, there is a process for you to get credit transfer credit. We do have students in Hawaii, Mildred. Yes, we do. We've had faculty go to Hawaii to be with students in clinic during their mid-clinical site visit and their preclinical site visit, and so we have been there. Great questions. Okay. So as far as the postgraduate certificate admissions criteria, remember this is for students who already have a master's degree and who are already APRNs. We do offer a plan of study for the PGC student. And you can kind of see here on the right-hand side of the screen all of the different specialties of the APRN that we accept into our PGC program. Basically, if you're already an APRN, you meet the criteria to come in as part of this program. I will say that the PGC plan of study is a little shorter than the MSN study is. If you take 2 classes per term, I think it's 6 terms that the PGC student has before the degree is conferred. There's 3 terms of didactic work and 3 terms of clinical. So it is a little shorter than the MSN track. So I mentioned the fact that we have 4 terms in a year, winter, spring, summer, and fall. And our term system is an 11-week term with 2 weeks break in between. So that's kind of how that we operate on an academic calendar. So fall would be 11 weeks, and then there's a 2-week break, and then we begin the winter term. You can complete your MSN in 2 to 3 years, depending on how fast that you go and how many courses that you take. The PGC student will typically finish within 16 to 24 months. And then The DNP is around 18 months. We do have a rolling admissions process. And what this means is that you can learn the status of your application as soon as 4 or 5 weeks after it's complete and submitted. So that is, I think, a good thing because I know when I applied to graduate school, it seemed like it was months before I got a decision. But we really do try to turn that around pretty fast for you. So around 4 to 5 weeks after you submit the complete packet, you should hear something. Upcoming application deadlines. So for the fall, we are already past the deadline for fall, but September 24th is coming up. This is the deadline to apply for coursework, which would begin January 5th of 2026. So September the 24th is the application deadline for that. And our tuition is currently $755 a credit hour. A little bit about the clinical experience. Both MSN and PGC students have to complete 750 clinical hours. So no matter if you're a master's student that's coming in or you're a PGC student that's getting your psych certification, it's still 750 hours. That recently was changed to 750 as a result of the National Task Force across the country and accreditation guidelines. Um, Basically, this is an across the country thing. All of the schools of nursing are required to go up to 750 clinical hours to meet accreditation and national standards. So it's 750 clinical hours is the requirement. Just a few people who you're going to meet on your way through the university. You know me at the bottom here on the right-hand side, you see Dr. Susan Piper. She is our clinical director and manages the clinical courses. And then we have course coordinators, course faculty, regional clinical faculty that really supervise your clinical hours. And then we have academic and clinical advisors, financial aid, credentialing coordinators. Credentialing coordinators play a really important part because what they do is they help manage contracts with clinical facilities. We have clinical contracts with thousands of sites across the country. But let's say that you want to do clinical in an organization or facility that we have never partnered with. That's fine. The credentialing coordinator will take it from there. They will work with that facility to get a contract going so that you can do your clinical time there. So they really do all of the behind the scenes work related to the contracts and that sort of thing. So those are just a summary, just a brief snapshot of some of the people that you're going to meet pretty soon after you join the Frontier community. Just a few pictures of our campus here in Versailles, Kentucky. On the left-hand side, you see the dining hall. At the bottom floor of the dining hall, we have the gift shop. There's also a 24/7 fitness center. Below that is a caption of some of the offices and student dorms. In the middle is the president's house. The bottom middle picture is just another picture of the dining hall. And then on the right-hand side at the top, we have the Welcome Center. And then underneath that, that's a view from the highway as you first go into campus. We're really proud of our campus. It really is beautiful. Lots of things to take advantage of. And it's only a few minutes from the Bluegrass Airport in Lexington. So not a bad commute. Any questions about anything? Any questions about the PMHMP role? Any questions about anything that you've heard in this presentation? Checking here the chat. So Marina says, are we also taking courses during clinical? So once that you go to clinical, that's what you do is clinical. Your didactic will be completed and over with. So when you get to clinical, that's all you focus on is your clinical courses. Christiana, you said you're a recent grad from Frontier. Um, are you still required to complete all admission applications? That yes, there has to be a separate admission packet done for the program. So since the psych program would be a new one for you, you would complete that particular um, application packet. Anything else on anyone's mind? This is an informal conversation, so please don't be shy. Speak up or type in the chat.
So this is Christiana. I have already been on the DNP bound in 2023. Do I still need to attend one of those?
So if you have been to Frontier in the last, when did you go to DNP?
That was recently just completed in June. I
Okay.
was there in, I think, September of 2023, I believe.
Okay, yeah. So if you've been a student at Frontier within the last couple of years, you're not required to come to the Frontier bound.
Oh, okay.
Yep.
Okay.
Yep.
Mm. And for clinical sites, I could probably find my clinical sites for practicum, correct?
Yes. So you start really, we tell students to start your clinical search as soon as you finish Frontier bound so that you can get an early start on that. And that way that you're not, waiting up until you're into the program quite a bit and trying to, put things together at the last minute. So we say to start the clinical search as soon as you get back. And what you do, I tell students to start off in your home community, do a community assessment, look at the services that your community offers, think about where you would like to do clinical, and then reach out to those places. What we found is if you go in person, students have told me that there's usually a more positive response if you go in person and try to meet someone and you actually sit down and talk about your program, what your goals are, and that sort of thing. And so that's a place to start. And I tell students to also make a list of where you've been, who you talked to, and what they told you. The reason why I do that is because if you run into, let's say, a problem securing a clinical site for, your last few visit types or something, your clinical faculty will already know where you've been and what you've been told. And like I said before, they're usually geographically assigned, and so they can tap into places that you've not been yet. So it's really good to just kind of keep a list of where you have been and where you've talked to people at regarding your clinical.
Okay. So for the postgraduate certificate for a full time, would that be about maybe 12 months or more than, I think, did I see 16 to 24 months? Would that be like a part-time for the 24 months?
So as a PGC, there's if you take 2 classes per term, which would be full time, there's 6 terms.
Okay.
You would have 3 terms of didactic and 3 terms of clinical.
Okay. Is that simultaneous clinicals and or
So you would take 2 classes each term. So term 1, you would take 2 didactic, terms 2 and 3, 2 didactic. And then each term, once you get into clinical, there's 3 clinical courses. And so the first clinical term, you would take clinical practicum 1. And the
okay.
second one would be clinical practicum 2 and then clinical practicum 3.
Okay. And 6 total.
Yep.
Okay. Hmm. With the clinical background, is that like a pass or fail?
Yeah, so clinical bound is a course.
Okay.
We call it clinical bound, and really that's the name of it. But the course title is MH750, and basically that's the course when you come back to campus and
Mhm.
you're involved in a lot of simulation, and we're preparing you
Oh,
to
okay.
go off into clinical. You do get
Mhm.
a grade for that course,
Mhm.
but it's really all about putting things together
Okay.
and really identifying what your strengths are and
Mhm.
what your opportunities are before you go off with your preceptor.
Okay.
Students have a lot of fun at Clinical Bound.
Okay. And I see the next class will be on January the 5th, 2026 or October.
Yes, January. The January 2026 will be the next enrollment.
Okay.
Mhm. Okay, let's see here. Michael wants to know about workload, papers, exams, weekly discussion boards. So you will find a variety of different assignments for each course. Not every course has exams. It just depends on the content of the course. There are some courses that it's appropriate to have exams. Some courses are more geared toward things like capstone projects, different types of assignments like that. So it really just depends. And as a student, you will see kind of a mixture spread out across all of the courses. It just really depends on the content and what's the most appropriate way to evaluate that and to really grade those assignments. We do have discussion boards. The discussion boards are more of an ongoing conversation with your peers, and you discuss like clinical cases, I think. So the instructor may post a clinical scenario and you go in and then you respond to that clinical scenario. And then the instructor gets you back together and then we talk about the case and that sort of thing. So the discussion boards are more geared toward clinical concepts and reasonings, but you'll see a variety of different um, methods of measurement in the courses. Tim says, are Psych MPs prepared to work with addictions and substance abuse? Yes, they are. You actually have that's threaded throughout our curriculum, but there is also one class um, that deals with substance abuse. You do take some substance abuse training sessions as part of the course, and that's part of what we do with Psych MPs. Let's see. So do we have to complete clinical in our home state? No, you do not. As long as you have an RN license in the state where you want to do clinical, that's fine. You're welcome. Any other questions from anyone?
I think there's a,
For the,
oh, sorry, go ahead.
I'm sorry, for the full-time FNP, the MSN program. I'm sorry, not FNP, the psych program, full-time MSN. When do you start clinicals for that one?
So you start, Sarah, are you able to pull up the plan of study?
Absolutely. Let me grab that.
I can stop sharing too right quick and I can pull it up and you can kind of see that. It will probably make more sense if we just show you what that looks like.
Do you want me to share a screen or you just want me to put the link in the chat for you, Dr. Scal?
You can share if you're already there. That'd
Okay.
be great.
Yeah. So let's see, make sure I'm getting the right one here. Okay, can you all see my screen okay?
Yes.
Okay, perfect. So this one is the MSN program of study. And I will put a link. Actually, I don't think you'll be able to access it through the portal, but here is that if you all need it. So based on this program of study, you could potentially be starting clinicals in term 6. And then for PGC students, this is what that program of study looks like. And that would be term 4, starting clinicals.
Okay, perfect. Thank you.
No problem. And Dr. Scaff, are you able to touch on that question about waitlisted students?
Let me see. I can find it. Okay. Miss Johnson, are you able to, do you want to talk to the wait list?
Yes. So the wait list is.
We're having trouble hearing you for some reason.
I don't know what's going on.
It's okay. Okay. She's going to type it in the chat. And while she's typing that in the chat, there is another question about um, can you bring someone with you when you come to campus? So we do allow families with like young infants and breastfeeding mothers. We do have some family housing, and you can get more information about that through our housing department. But we do offer some family housing units. Having said that, you can also choose to stay off campus if you want to as well. We don't require that you stay on campus. We encourage it, but we don't require that. And so I think you can kind of do either or. Any other questions about anything?
I have a question.
Yes.
Have you had students like like I was saying, I'm in Germany.
Mhm.
Have you had people take classes and then because that's what I'm hearing from people. They say they've been taking the classes part of it and then they come back to the States to do the clinical.
Mhm. So you can do your coursework anywhere as long as you have internet. You can do
Okay.
your coursework, and then you can come back to the States and do clinical for sure. Yes.
Okay.
Yep.
I just wanted to clarify that.
Absolutely. Mhm.
I have a question about new graduate psych NP opportunities because
Mhm.
I currently work inpatient and mostly with psych NPs.
Mhm.
So as a new grad, would we more have an option of working in an outpatient setting, or is it typical for new grads to go straight into that inpatient? Because I'm a little tired of inpatient. I kind of want to see
Yeah.
how outpatient looks.
I understand completely. Yes. So yes, you can go right straight into outpatient. Absolutely. That's what I done as well. I spent years in the outpatient arena. I learned a lot. Um, but I was not like a psychiatric nurse that worked in a psychiatric hospital in my nursing career. My background was critical care. And so I wanted to see what the other side, what the inpatient side looked like. And so that's where my practice is now. And I've learned a lot there. But honestly, and I tell students the same thing, you deal with sick people on the inpatient side. But honestly, the treatment focus is narrow. You're looking at stabilization and disposition. When you work on an outpatient basis with people, you're their primary mental health provider for a long period of time. You get more into things like managing psychosocial issues, therapy, managing more side effects, dealing with just a broader array of things with the patient than you do when you just work inpatient. So yes, absolutely. New grads can go into outpatient, um, private practice, the whole gamut for sure.
Thank you.
Yep, no problems. Alina, yes, housing is provided. We do have housing on campus for the on-campus experiences. Absolutely. There was a question about tuition. So the tuition is $755 per credit hour.
I think I've seen something of the scholarship, something on scholarship.
Mm-hmm.
Is there a site for application to kind of do the application?
There is on the portal page when you log into the portal page.
Okay.
There is an icon that you can click, and it takes you to the scholarship homepage, if you will.
Mm-hmm.
It talks about all of the different scholarships and
Okay.
it includes a link for you to apply.
Okay.
Yeah. Right now we have over 20 scholarships that we offer to students.
Okay.
Mhm.
Mm. Voilà.
Okay. Any other questions? Okay. Sarah, do you have anything to add?
I don't think so, but I am going to drop in here our team's email address just in case anyone has any questions after the fact. We love to hear from you all.
Mhm.
Well, it's been a pleasure to take some time out and talk with you about the program. I really do appreciate you making time in your busy lives. I know everyone is so busy. Um, if you have any questions after you leave here, please don't hesitate to reach out. We're here for you, and I hope that everyone has a great evening. Okay.
Thank you.
Bye, everyone.